I'm Larry Mency. Welcome to Another Thing. You go to the hospital or you go to your doctor for a procedure and you think you're covered by your insurance, only to get hit with a surprise bill because someone who treated you was out of your network. This has become a major problem in this country, with tens of millions of people being hit with surprise medical bills. There is a move right now to bring this under control state by state, but special interests are getting in the way. Ellen Kolodziej kicks off our coverage of this important issue that is not getting enough media coverage. Ellen.
Lawmakers here in New Jersey have been working on a bill for years that would cut down on what they consider price gouging by some doctors and some hospitals, especially on those surprise bills that some patients get when they go out of network. But one Republican lawmaker says some parts of that bill could cause more harm than good.
We're really like part of the metropolitan Philadelphia and New York area, with the smartest doctors in the country are in this region. So if we start to look at ways that we're going to limit how much money they can make by putting these constraints on, then we're going to drive them out of the state.
Assemblywoman Nancy Munoz knows all about the rising cost of health care. She was a nurse and her late husband was a surgeon.
There are people who are charging way too much. I mean, $120,000 for an arthroscopic knee exam is ridiculous, and the public is unhappy with that, as they should be.
To rein in those costs, New Jersey Democrats have introduced a bill called the Out-of-Network Consumer Protection, Transparency, Cost Containment, and Accountability Act. One of the main sticking points is a provision that would limit payments to no more than 2.5 times the median amount paid by insurance companies. Assemblywoman Munoz and most doctors are vehemently against this idea, and the group representing them gave us this statement. The Medical Society of New Jersey is in negotiations with legislators to craft solutions that are fair to all stakeholders. We believe the best way to eliminate surprises is to increase transparency so patients can truly understand their insurance and health care options.
The arbitration that it currently exists is similar to baseball arbitration. One person puts out one number, another person puts out another number, and you pick one of the two. That's, you know, you have 120,000 versus 1,200. It's not right. So there should be mediation where you find a cost that makes sense to both parties.
Now, all the stakeholders involved, the doctors, the hospitals, the insurance companies, the patients, they all seem to agree that something needs to change. But it will take more negotiating before lawmakers can come up with a bill that everyone can live with. Reporting for Another Thing, I'm Ellen Kolodziej.
All right, thank you, Ellen. To talk more about surprise bills that consumers get, I'm pleased to be joined by Chuck Bell, who is the programs director at Consumers Union, and Consumers Union is the policy arm of Consumer Reports, which everybody knows of, the magazine that rates products. And so when they have a problem, you go out to try to change policy.
Absolutely right.
Is that the way you phrase it?
Yes, absolutely right.
Let's back up. Let's go to square one. Why do consumers get these surprise bills, these out-of-network bills?
You know, there's many different reasons, but the health insurance system is now organized around networks. And if you're in a health plan network, your insurance company has a contract with the doctors that are in that network. But there's a whole range of other providers that you might see in the emergency room or the hospital that are out of network, that don't have a contract with your health plan. And so the procedures for paying those out-of-network doctors vary to a great extent. Some consumers have out-of-network coverage, so they'll have a plan that will pay maybe 80% of the out-of-network charge, but many other consumers don't have any out-of-network coverage, and the physicians or the providers can send what's called a balance bill. So whatever the insurance company pays, if the doctor feels that they're entitled to additional fees, they can send a bill to the consumer, and it can be for literally, you know, $5,000, $10,000, even as much as $100,000 we've seen in some cases.
And just to make sure people understand this, so they can go in and have surgery, and they might have done their due diligence, and they might have checked to see if the hospital and the doctors and everybody is in network and they're fine, and there might be a specialist that's called in and that person's out of network, and then boom, they get hit with a cost. Is that it?
Yeah, exactly right. So that's why we call it a surprise bill. One aspect of it is what we call drive-by doctoring, is sometimes you'll be in the hospital, you might be completely knocked out, and a physician assistant or an assistant surgeon comes in the room, and you get surprised, you get a bill from an out-of-network doctor that you never expected to see. In other cases, we get a lot of complaints from consumers who are seeing out-of-network anesthesiologists that are called in to help with a procedure that the in-network surgeon or doctor is doing. So we hear from a lot of people who, would really dearly like to stay in network. I mean, most consumers do their homework because they don't want to have unexpected cost sharing. But we hear from a lot of people who are frustrated because regardless of how much work they do to make sure that they're staying in network, something bad happens. They see an out-of-network doctor in the ER, or when they're having a diagnostic test, outside doctors called in to read the chart or read the test or the x-ray. And so what we're doing here in New Jersey is we're really pressing the legislature for a comprehensive solution to the problem.
It ruins people's lives. That's the way it's described by people, that they spend years trying to fight this, and sometimes there's no resolution. So it's an enormous problem, and I give Consumers Union and Consumers Reports a lot of credit, because I don't think this would have come to the forefront had it not been for you.
Yeah, well, it is tremendously frustrating, and it's surprisingly common. If you go to a dinner party and you ask around the table, have you received a surprise medical bill, you'd be surprised how many hands will go up. We had an experience in New York State where the insurance department really took a very active interest in the issue. They were receiving about 2,000 complaints from the public every year about medical billing, and another 1,400 complaints going to the insurance companies. So it was the most complained about insurance issue in New York State. And so they developed a comprehensive bill to address all of the different aspects about improving disclosure and notice to the consumer, holding the consumer harmless. So if you're in the emergency room, disclosure isn't helpful. You're not in a position to jump in the car and drive across town. So we need to make sure that all the providers within the emergency room, at a minimum, are going to be in your plan network.
And you were involved in that legislation and helping to get it through in New York. Is that now the template for other states?
It is. We very much cheered them on. Governor Cuomo put it in the state budget, and we were able to get both the insurance companies and the medical society and the hospitals on board with it. So we think that people do understand that this is a terrible problem for the patients, and if everybody is willing to make some reasonable accommodation, we can work out a compromise. So the New Jersey law that we're supporting, it's A4444 and S20, is a very comprehensive bill modeled very much on the New York approach that increases consumer protection sort of across the board, so that if you see an out-of-network doctor inadvertently, you would be protected from that charge.
Now, we tried to get the sponsors of the bill to come in and be on the show, and I've tried to go to their offices to interview them, and they've been putting me off. The feeling was that they're not doing as well with the bill as they thought they were going to do, because they're running into resistance from special interest groups. Who are the special interest groups that would be fighting this bill?
Yeah, first of all, I give the sponsors a tremendous amount of credit. It's a really good bill. We strongly support it, and we're joined by groups like AARP and National Multiple Sclerosis Society, New Jersey for Healthcare Coalition. But I think the issue is a lot of the parties can live with the provisions of the bill. There are certain providers or certain hospitals that sort of have a business model where they like to invite patients in and bill at the out-of-network rates. And so insurance companies, because of an existing loophole, have to pay the higher rates for many out-of-network procedures. So the insurance companies are generally wanting to see some type of solution in this area. There are some specialty groups of providers that are often out of your plan network, such as anesthesiologists, radiologists, certain types of surgeons, and others.
And their problem is they just want the money?
It's complicated. Yes, in some cases it's a price gouging type of issue. I mean, we have the most expensive healthcare system in the world, and I think patients are entitled to a more rational way of setting fees and prices. If you had the same fee for the procedure across the board, it might be a lot easier to solve this problem. But insurance companies pay at all different rates, and Medicare and Medicaid pay at a lower rate. So it's complicated to get to a solution that everyone can support, but I think the important point is this is an untenable and unreasonable situation for the patients.
A couple of quick things. Where are we in Pennsylvania right now?
So we have an insurance commissioner, Teresa Miller, in Pennsylvania, is quite interested in surprise medical bills, and she's holding a hearing on October 1st in Harrisburg to hear from patients and provider groups about these issues. So she also recently put out a notice saying that if you're at a health insurance company, your provider directory better be up to date, or she's going to come down on you like a ton of bricks. So we like that, because consumers look up in the provider directory, they want to rely on that information. It better be accurate. We agree with her position on that.
And you expect the New Jersey legislation to pass eventually?
Yeah, I think we're getting close to a solution, and the sponsors are talking very intensively with all the stakeholder groups, trying to meet everyone's needs. But I think there does need to be a reasonable compromise. One of the features of the bill is also that there's mandatory arbitration or in a dispute resolution. If the insurance company and the health plan can't agree on what should be paid, there's an independent dispute resolution process that takes the consumer out of the middle of the bill, so that you're not caught in the middle of a billing dispute that you really have no tools or mechanism to solve.
And finally, if there's someone out there who has been hit by these surprise bills, do you want them to contact you?
Absolutely. We have an insurance complaint tool. So if you go to our website at consumersunion.org, you'll see our surprise medical bills campaign, and we are very interested in hearing from patients who have had this problem. We'll help you if we can, but our push is really to get better consumer protections so it doesn't happen to begin with.
Chuck, I really appreciate you being here and the work you're doing. This is an extremely important issue, and as I said, I don't think this would have come to the forefront if it wasn't for Consumers Union, so I really appreciate what you do. When we come back, we will be talking to a consumer who has been hit by surprise bills, and we'll find out what it did to his life when Another Thing continues.